Okay, we're live, folks, so let's call the meeting to order. Welcome to our electronic committee of the whole meeting on March the 9th, 2021. Due to the COVID-19 pandemic, Regional Council is practicing physical distancing. In an attempt to speed things up, we have assigned a mover and seconder for all recommendations contained within the agenda package. I will read these out at the appropriate time, and then I will state the result of the vote. I'll now ask Clerk Tim Brubaker to conduct the roll call.
Thank you, Chair Galloway. Chair Redman?
Present.
Councillor Armstrong?
Present.
Councillor Clarke?
Present.
Councillor Erb?
Present.
Councillor Foxton?
Present.
Chair Galloway?
Present.
Councillor Harris? I saw him earlier.
Hello.
Councillor Harris? Oh, there we are.
Hello. Hi. Yep.
Councillor
Hey,
Jaworsky?
I'm here.
Here.
Councillor Jowett?
Here.
Councillor Kiefer?
Here.
Councillor Lorentz?
Here. I've been here since 8:30.
Councillor McGarry?
Here.
Councillor
He's one of those early He's one of those early seniors.
Yeah.
I'm here. I'm here.
Councillor Shantz?
Here.
Councillor Strickland?
Here.
Councillor Vrbanovic is in the waiting room. Okay, that would be all present.
All present? Okay, thanks very much. Any declarations of pecuniary interest? Seeing none. Oh. I don't see that. Why am I not? Oh, okay. Councillor Clarke.
Thanks. Sorry, I was madly waving virtually as well as in real life. I have a conflict item 5.4 on the agenda. I have an indirect pecuniary interest due to my employment with the YWCA.
Okay, that's been so noted. At this time, Chair Redman has a statement to make.
Colleagues, March the 11th will be observed to commemorate all those who've lost their lives in COVID-19, and this is the last meeting we will have before that date. So I'm asking for the committee to support lowering the flags at regional headquarters and ask other municipalities to do the same. This is happening across Canada, and we will also do something on March 25th, including lowering the flags, but with a hopeful message because the vaccines are here. So I don't know, Chair Galloway, if we want a motion or just if we have consensus, but I think this is a somber but a significant commemoration of the people we've lost in our community and across Canada to COVID to be observed.
Well, I think there will be consensus on that, so I'm not sure we have to have a motion unless people feel otherwise. But I think it's certainly a very appropriate gesture on behalf of the region in respect to to that particular matter and the number of deaths that there has been in our region, of course, around the world. So that's quite appropriate. And if everybody agrees with that, then we can proceed in that particular manner. Okay. Councillor Kiefer?
No, I don't have anything. I'm just agreeing with you.
Okay, good. Okay, Councillor Shantz?
Thanks. So that's on March 11th, just for the day? Thanks.
Yep. Okay, thanks very much for that, Chair Redman. That's quite important. We'll now move to the consent agenda. If anyone wants to remove an item from the consent agenda, so indicate now, or if you have any questions regarding any of the particular matters on the consent agenda, you can so indicate now. Councillor Erb.
Thank you, Mr. Chair. And I just want to, it's in reference to 5.1, the Waterloo Region Master Plan update. And when I first read the report, I was wondering what the relationship is intended to be between the region, the private sector, and maybe the not-for-profit for funding, since it's coming from the same source, and would we be in competition with one another for those same dollars in those three sectors? But I think it's important to remember that the funding referred to in this report is the 10-year national strategy for the federal government. And I think we're in about the third or fourth year of that right now, where it seems to me there's unlimited funds available. It's simply a matter of asking. And the funding in this report refers to the Waterloo Region Master Plan that we approved in 2019. But I'm wondering if Ryan or if Mr. Petitpierre is on and perhaps could just give us an overview of all of the funding available and how this funding that we would be applying for would not in any way conflict with other organizations in the region that might be applying funding as well.
And who can answer that?
Ryan's on the call.
Ryan's on the call, yes. Ryan, can you take that one, please?
I can, Mr. Chair, and back through you. So, Councillor Erb, you're correct in identifying the funding source as being available through the federal government's National Housing Strategy. So if you cast your mind back a few years, 2018, the strategy was released from the federal government. And at the time, it was a $70 billion strategy over 10 years of time. About 40 billion of those 70 billions was dedicated for the purposes of new rental affordable housing through the co-investment fund as sort of their flagship program, and also the seed funding, both pots of which are identified in the master plan report in front of you. Eligible entities for those funds include municipalities, include not-for-profits, and include the private sector. So we're into about year 3+ of that strategy. And so although the funds aren't necessarily unlimited, there are a great deal of funds that are available to support projects like this. So at the time of approving the master plan, one of the ways that we had identified to finance it was through accessing these funds through CMHC. So that's what's referenced in the report. And there are significant funding dollars remaining in that co-investment and seed funding stream to carry eligible projects through over the remaining term of that strategy, which is 6.5, 7 years or so. So while we may, to go back to your point of competition, there may be competition at some point for those funds. Right now, as long as you have an eligible project, the dollars are there regardless of your status as an entity, be it not-for-profit or municipal sector. I hope that helps answer the question.
Yeah. Thank you. Have we been refused? If we've submitted an application, have they all been approved?
Thanks. And through you, Mr. Chair, we're still in the application process for the overall master plan at this point. So part of our application has been submitted, and go through projects, that application will evolve. So no final approval overall as it relates to the master plan on these. We're still in the process of submitting.
Okay, thank you.
Okay, thank you. Any other questions or comments related to the consent agenda? Seeing none, it's moved by Councillor Armstrong, seconded by Councillor Foxton. We'll take all the items except for 5.4, which is the matter that Councillor Clarke has declared a conflict on. So if you'd use your icons to vote accordingly. That's approved. And then once again on item 5.4, regional development charge grants for affordable housing projects. If you vote on that separately. And that's approved. Thank you very much. The consent agenda now behind us. We'll move to the regular agenda. And the first item is we have a verbal update on COVID-19 by Associate Medical Officer of Health, Dr. Julie Emily. And welcome, Dr. Emily, and welcome without the acting moniker for the first time, at least first time for us. So welcome.
Yes, thank you very much. Kathy, are you going to load the presentation? All right, Kathy, if you could move to the next slide. Public health measures are effective at limiting, oh, sorry, wrong slide. I'll start at the beginning. Our indicators are still high, but continue to remain stable at this time. Our weekly incident rate currently sits at 52 cases per week per 100,000 residents. This has fluctuated over the last several weeks between 50 to 60 cases. We are currently managing 376 active cases and 24 active outbreaks. Taking into account interim data, our latest percent positivity is currently at 2.9%, and our latest reproductive rate is now back to 1. We continue to monitor the indicators closely, but we continue to remain within the red zone of the province's framework. Kathy, can you go to the next slide? In Waterloo region, 154 total variant cases have been identified. 11 cases have been confirmed as the B117 variant, or commonly known as the UK variant. 143 cases have screened positive and are waiting confirmation for this specific variant. In Ontario, 4,395 variant cases have screened positive. Provincial modeling has projected that the variant will continue to grow, which is what we are seeing, but the growth can be slowed by practicing public health measures. And in closing remarks, public health measures are effective at limiting transmission and slowing the spread of COVID-19. As a reminder, these measures include avoiding social gatherings with those outside your immediate household, limiting non-essential trips outside your household, practicing physical distancing, wearing a face mask, washing your hands often, avoiding enclosed, poorly ventilated spaces and crowded places, staying home when you are sick. We know it can be hard to see when public health measures are successful because success is often the absence of the worst case scenario. The worst outcomes have been prevented, so we're not seeing them. These measures are difficult, but they have made an incredible difference. We know what to do, stay committed to public health measures, limit our close contacts, and stay at home as much as possible. As Chair Redman indicated, there is hope on the horizon, and we are encouraged to see this. Thank you.
Okay, thank you, Dr. Emily. Councillor Shantz.
Thank you. Thank you for the update. Have all of the variants that have been identified in our region, are they all B117 or are there some other ones?
Yes, so far, the variants first screen as a positive, meaning it's one variant, but you don't know which one. So far, all the ones that have come back with a confirmed strain have all been B117 or the UK variant.
Thank you.
Councillor Erb, is that a raised hand or is that just an old voting icon?
That's just an old man not taking an old down.
Okay.
Sorry,
That's fine.
They don't go down automatically anymore.
No, staff can take it down. There it goes. Dr. Emily, starting tomorrow, this is a vaccine question. Starting tomorrow, the province is given the instruction or the guideline that we're only going to administer one shot of the Pfizer vaccine, and then there'll be a lag, possibly as long as 4 months till the second shots are given. For those people who got their shot today, so to speak, or yesterday or previously, will they get a second shot, or will all second shots from here on in be at the 4 month or thereabouts interval? Or has that been decided yet?
So the ministry is providing direction on that, but we expect to move forward with anyone who has received their first dose and are waiting for their second dose, and anyone who is set to receive a first dose will all move to a second dose received at a 16-week interval. So everyone will be delayed. We know this is from recommendations nationally, and what we have seen in other countries where they've pushed on first dose and vaccinated as many people as possible. They've seen significant decreases in community infection rates, hospitalizations, and death. And we know that the vaccine in those circumstances has been effective out towards, I think most of the data is at least at 3 months. And doing this will allow us to vaccinate everyone within Canada who's eligible, probably by the end of June versus the end of September.
Okay, great, thank you. Councillor Lorentz.
Thank you, Mr. Chair. I see you open the door. Are we going to get a vaccine update distribution, or is this the time to talk about it?
The vaccine task force, I would defer to the vaccine task force for an update. I can answer specific questions about the vaccine from a medical perspective, but Bruce, I don't know if you could clarify that.
If the vaccine
It's only been 8 months. The vaccine task force update will be Friday, the public update. I'm happy to do my best to answer questions with Chair Redman and Dr. Emily, if there are any today.
Councillor Lorentz.
Well, I could probably wait till Friday, but I think there's been a number of things that have been happening in the community that I've noticed. I think for one, it seems there's a lot of misconceptions out there, and especially by the local media on how well it's going. I happened to be listening to 570 the other day, and the guy that hosts Rant and Rave didn't even know what category was being tested at the boardwalk where that station is located. So I think we need to try to work with the media so they can get good information out. I think one of the problems that we're having, because this is all new, is people coming early for appointments, like 2 hours early. And we need to really stress that, you know, your time frame is this time, and if we're a little behind because of the age category, we'll give you a number, or we'll get your phone number, and you can wait outside in your vehicle and we'll call you, you know, all those kinds of things. I think I was up there yesterday, and we have a number of former regional employees volunteering up there. And I think we need to have a call out to everyone that wishes to volunteer and be part of this operation. At least submit. I'm on the 2019 novel coronas COVID-19 regional website, and I really don't see anything about asking people to volunteer. And so I know it's early, and I know we're getting better as the day goes on, and it really bothers me when people criticize that we're not doing enough. But I think there's an opportunity for the criticizers to get involved and be part of the solution, not part of the problem. You know, I'm reading a book right now about how the Canadian Army started out, and it's kind of amazing to see that during the Second World War there wasn't conscription, but Canadians stepped up and did what they had to do. Near the end of the war, they were the front of most major battles, and there was a lot of casualties. But I look at this as a war on COVID, and I think all of us have to try to figure out what we can do to be part of this. It's not going to go away unless we all start putting our shoulder to the wheel and figuring out where we can fit into all of this, and how soon we can get everybody in our community inoculated. So those are just my thoughts. I was up there yesterday. It was running very smooth. They were running a little behind. You know, the age group, everybody has either a wheelchair or a walker, and they have other family members with them. So it becomes a little hectic. But on the same token, there was no complaints from anybody waiting in line to get the vaccine. Maybe some of the caregivers were complaining a little bit, but I think we're doing a great job up there. We're looking at getting more space, and when we start opening up all of these other centers, I think we'll really have something that other communities will be envious of. And it all just takes time and I think patience. But I guess my message is to the media: let's try to be more positive and work together to try to give people good information, not bad has-been information. And that's my infomercial. Sorry about that.
Okay, Councillor Foxton.
Thank you, and through you, the chair. Yes, I received an email, as did Chair Redman and Councillor Armstrong, from an individual who said they had got and called in at like 6 in the morning, and they were still on the phone at 8 at night. Finally got through, got the appointment booked, and then something happened, and it was basically a mess. And so Chair Redman and myself responded that we would look into this and that. Happened to be on the phone with my sister-in-law that day, who lives out in Airdrie by Calgary. They got on the phone at 6 in the morning, did not get through till 7 at night, and they booked her into an appointment in downtown Calgary, which is quite a distance from Airdrie for her. And very frustrating for her, and she's all upset and everything else. She decided to go online. It took her 15 minutes to register, to get the appointment in Airdrie, and it was seamless. So I think the phones are overwhelmed right now, and a lot of the problem, that's one of the problems, is the phoning. If we can get more people to do the online, it seems to be running quite smoothly, and have people out there and make it public. You know, if you're a family member of an elderly person that needs to get a shot, help them register online. And then again, there was posts yesterday, Councillor West, in regards to telling people do not show up until 15 minutes before you need your shot. And that went through Facebook and Twitter, and I re-shared them, and we all have to do that. So it's an education process. People are panicking, especially the older group. They really are afraid that if they don't get the shot, they're putting their lives at risk, and they could be. And so what we're seeing is the frustration and the fear that they're going to get bumped or it's going to be too difficult. So we have to just reassure them, and we have to do the process correctly. And Councillor Lorentz is exactly right. And the press is going to do what the press is going to do. But we have to do exactly what we are doing. Talking to the people, saying, you're going to get your shot. Work with us. And when we look for the good in people, a lot of times we find it. And that's what we have to reach out and try to get to the people. And those that are frustrated, let's be a sounding board for them, because they need to put their frustration somewhere. I'd rather them yell at me than go after a family member or a neighbor or a friend and have a physical problem. So if they have to yell at me, they yell at me. But I think we're heading in the right direction. Recommend online for sure. I've talked far too much. Thank you.
Bruce, Mr. Lochner, you want to?
I'll defer to you, Mr. Chair. Perhaps take more comments, and then if there's questions at the end, I'll clarify.
Councillor Vrbanovic.
Thank you very much, Chair Galloway. I want to acknowledge, I know staff are working incredibly hard to get this up and get it running. And the reality is that there are going to be, a few growing pains along the way, but I think we're doing very well. And this isn't a comparison game with other jurisdictions, but actually when you do the number crunching, you actually, and not just look at the raw numbers, you realize that we are doing very well. The point that I wanted to raise, however, was there was some social media activity last night, and I don't know if this is accurate or not, about caregivers not being able to go in with their elderly parents, and some of them maybe have some dementia or whatever the case is. I'm not sure if that is the case, but if it is, I think it's something that we need to adjust or correct. I know we're trying to limit the crowds in there from a public health point of view, but there's also other issues that need to be considered, particularly as you with the older adult population that have additional challenges. So I don't know if you want to comment on it later, Mr. Lochner, but if not, if you can look into it, that would be great. And the only other point that I would make is there the calling in for our accessibility transit? Is it on the same phone lines? Because there's been some talk that there's also we've changed the way that people can book that to only 3 days ahead of time, and it's creating a lot of anxiety amongst those users because they're not able to book for medical appointments and so on. So those are the two issues that I'm hearing about.
Okay, Councillor Kiefer.
Thank you, Chair. My question, I guess, is sort of on the heels of, or on the back of what Councillor Lorentz was bringing up. And I'm wondering if we know, if staff, I mean, we're doing a great job as is, but I'm wondering if staff can tell me how many people from Cambridge are going up to Kitchener to get the vaccination. And there's a couple of reasons I'm asking that. One is I agree that 80-year-old plus persons shouldn't be, that are in walkers have to line up or be in a position that they have to, wait. I like Councillor Lorentz's suggestion of, maybe getting a call back, or the people waiting in a car is much better than that. But I was curious as to see how many Cambridge people were taking up the offer to go to Kitchener, if we even know that. Not sure, but those are my comments. If Mr. Lochner wants to comment.
We'll ask Mr. Lochner, but I suspect in that case, that'll be a question for Friday, possibly, to get that information. Councillor Shantz.
Thank you.
Thank you. Sorry, my picture keeps moving around and I can't catch my mute button. I just wanted to, since we're in a public meeting here, is that we've had some concerns, and I've brought it up about getting a clinic of some sort, a part in Elmira, and we are working with the medical staff and the regional staff to see how we can make that happen. So I appreciate the efforts of everyone involved in working towards that end, and I look forward to hopefully getting something local. Thanks.
Okay, Mr. Lochner.
Thank you, Mr. Chair, and thank you, Council, for many good questions. I think there were some comments that may lead to questions as well, so I'll try to address them in sequence. First, I appreciate the acknowledgement of staff, both public health staff, our physicians, our nurses, our hospital partners, paramedics, and so on. These are individuals who like me, started January 25th, 2020, Dr. Emily, and are exhausted. So I want to do a shout out to all the frontline workers who are just killing themselves to make sure we're vaccinated. Behind the scenes, things like registration, diverting library staff to make calls, some members of our engineering crew working on logistics and facilities and so on. So just a huge partnership and a huge lift in this community. And again, that's what Waterloo Region's all about. So want to thank everyone. This reminds me of March last year around masking, around PPE protocols. And we all acknowledge that in this country, things have been less than perfect in terms of supply. We were in a mode across this country in terms of managing very limited supply and who do we give to. And so very methodically going about this based on provincial guidance of this group and then this little group and then this little group. And thankfully, we're now hearing that we are likely to get much more vaccine than we anticipated, much quicker than we anticipated. So that is causing us and all public health units across the country to shift, to try to ramp up, and I'm confident that we will be ramping up to more than 50,000 vaccines a week, based on the plan that has been outlined. In terms of how we're doing this, volunteers are key. We're working with the Volunteer Action Center, Jane Hennig and her crew. Really appreciate that. We have so many volunteers who have signed up that we have well over 100 volunteers who we can't use at this point in time. The issue is not volunteers of lay people, although we really appreciate that. The issue is clinicians. There are only so many nurses and doctors. There's shortages in hospitals. There's shortages in home care for nursing and physician staff. And that's our rate limiting step. And again, this is not to say that all those nurses and doctors aren't busting their butts. They're working during the day seeing patients, and then they're working in the evening at these clinics, or they're working in the evening and the day and these clinics. So the rate limiting step is actually the clinician ability and the number of vaccines we have. I'm pleased to say that we're working through our physician leaders, like Dr. Joe Lee in the KW4 Ontario Health Team, and Dr. Sharon Ball at the Cambridge North Dumfries Health Team, who have organized with their colleagues, again, physicians and nurses, to step up and volunteer at places like the Boardwalk. They will be also at the site in Cambridge. We're expanding. There will be sites in different locations in the region. There are Indigenous sites. And again, all of these have to be staffed by nurses and doctors. So it's not the volunteers that we're short of now. It's we can only go so fast based on the amount of vaccine we have and the number of nurses and doctors and paramedics who are doing this work. In terms of caregivers, I will address that. I've already sent a note to the operations group to ensure that we're communicating appropriately with caregivers, escorting their loved ones into the sites. How many people going to Cambridge? I imagine that's how many people are going from each community. We are roughly equal from all communities going to these sites. We are a fraction of less than 1%, less than 0.5% differential between most municipalities going to these sites at this point. I think that will shift again as Rona opens up, but again, we're shifting to a mass amount of vaccine, and we just aren't seeing in the data any variation amongst municipalities where some municipalities have fewer people going to sites because of location. People are driving and or getting assistance from friends or loved ones to drive. That does not mean that we will rest on that. We, of course, have mobile teams going out into neighborhoods. We have mobile teams going out into locations across the region because we do recognize that not everybody is mobile. We have people at home, and our home care partners will be going into people who simply can't get out of their home. So this is a layered approach again, and as we get more vaccine in the weeks and months ahead, we will see more of those 5 different approaches, the fixed clinics, the mobile teams, and so on. Then I'm confident we will get everybody who needs a vaccine. Early summer seems to be the target that the government is now saying. So they're talking about everybody who needs or wants a vaccine. And Dr. Emily, correct me, but we're hearing roughly June across the country is the new target rather than September. Yeah. So that's great news.
Okay. Well, thank you very much for that. And I guess we'll get or Chair Redman, you want?
Thank you, Chair Galloway. Sorry, I should have gotten faster to my icon too. I feel Sandy's pain about zipping around this Hollywood Squares. Mr. Lochner's given a great sort of overview. I guess the only thing that I would like to add is because Regional Council is a Board of Health, you know some of the intricacies that the media and the public don't know. And I know the analogy's often been made that we're building an airplane while we're flying it. We have a great plan, and as we implement it, we're going to find out where the gaps and the holes are. And Mr. Lochner was really talking about the balance between efficiency for large areas and the targeting and focusing to make sure that we're meeting the needs of specific subgroups. So that will be a continuing sort of dual approach as we go forward. we were looking at a vaccine in September for a year out, so we have to appreciate that we're much farther ahead than anybody thought. And so I guess I would just also like to underscore the participation in the offers of help, and that includes staffing from all area municipalities, and that's greatly appreciated because we recognize again that we're all in this together, and that collaboration is really important. And so as we go forward, we will be tapping on your shoulders as area municipalities to step up, although most of you have already stepped up. So thank you very much for that as we go forward with this vaccine rollout.
Okay, thanks. We'll move on then, and we'll transition right into a wastewater matter, from vaccines to wastewater. So the next item is the Manitou Wastewater Residuals Management Center and the rate structure there. Are there any questions in regards to that matter? Councillor Clarke.
Thanks, Chair Galloway. I did just have a question. I'm trying to get a sense of the impact of these increases. It's more than 100% for holding tank and 43% for septage. But I don't have a context to put any meaning to those numbers. So I don't know, for instance, how often a household would have to contract with a hauler to have their septic tank pumped. So I'm just wondering whether staff can just put that number in some context in terms of impact on households, impact on businesses that use these services.
Sure. Okay, Mr. Schmidt.
Through you, Mr. Chair, probably on the septic tank, it's probably every year or two that you would be doing that. So that is relatively infrequent. For the actual wastewater, it really depends largely on the size of the tank and how much wastewater you produce. So it could be every 2 months, could be every 3 months. It really can completely vary depending on the size of system you have and how much wastewater you actually produce. The rates, though, that we are charging are in fact very similar to the rates that are being charged in any of the communities around us. So it truly is the cost of doing business as is being shown by others around us.
Yeah, thanks. And I appreciate that. I wasn't objecting to the increase. I was just trying to understand its impact. So, and am I right in imagining that the holding tanks would be largely industrial and the septage would be largely private households?
It could be a combination of those. I wouldn't have that information. I'm not sure if Nancy Kadusik has that type of information. I would also say many of our customers, because we didn't have enough capacity to deal with all of the people from the regional Waterloo, many of them were probably having their septage and wastewater shipped externally anyways, and were already paying the higher rate.
Okay, thank you very much.
Okay, no further questions. It's moved by Councillor Erb, seconded by Councillor Foxton to approve the new fees. So if you could vote with your yes and no icons. And that's carried. Thank you. The next item is the Kressler Road resurfacing project. And I would draw your attention to the written submission from Randy Schaefer and Sherry LaRocque. There's no presentation on this, but questions on the matter? Seeing none, it's moved by, oh, okay, sorry, Councillor Nowak.
I just wanted to mention, I appreciate some of the anxiety that's happening with the individuals that live along Kressler Road. Out of the 9 homes that are on there, I believe there's 5 or 6 of them that are seniors, and some with some health issues. So you know, when it comes to clearing the snow in the wintertime, it's going to be a bit of a problem for them. I understand that. I've received a number of calls from these individuals, and those are the ones that really have been opposed to the sidewalk. Having said that, I think you have to look at the greater good, and that the sidewalk is going to benefit the entire community, the people that live off that road as well. We've had similar situations in the village where sidewalks have been installed and people have been upset about that. You know, you give it a year or so and go through a winter or two, and it seems to people have found ways to adapt. You know, we've got neighbors helping neighbors, people with snow blowers helping doing the snow blowing for the seniors and that sort of thing. So I'm hopeful that that we'll see that same sort of cooperation with the neighbors going forward. So I am supporting this, although you know, I do recognize the concern of some of those individuals. I just wanted to point that out. Thank you.
Okay, thank you very much, Councillor Nowak. Any other comments or questions on the matter? It's moved by Councillor Nowak, seconded by Councillor Shantz. Could vote accordingly. Councillor Jowett, is that a vote or is that a question?
That is a vote.
Okay.
Chair Galloway.
Thank you. Okay, that's carried. The next item is an information item on the automated speed enforcement. It's an update telling us the 8 additional locations. Councillor Shantz.
Thank you. Appreciate the 8 additional locations. I'm just wondering, I continue to get questions about speed enforcement in the villages, and so for the public, could someone just discuss, will this ever be available other than school zones? And I know we've had that presentation before, but if someone could just do a Coles notes for the public.
Okay, Mr. Schmidt.
Through you, Mr. Chair, and maybe Mr. Vanderkeer can add, it really is at this point up to the province whether that becomes available. I think they will obviously monitor and watch how the school zones and community safety zones program works. But at the end of it, it's up to the province to decide if that is going to be used any further out there. And with the restrictions that are on it right now, it's actually very difficult. So before we place the camera, we have to put up signage 3 months in advance saying we're going to put up a camera in that location. So it's not as easy as just moving a camera from one location to another location as the police might do with their radar control to do that type of work. It's quite restrictive. Mr. Vanderkeer, would you have anything to add on that?
Thank you, Mr. Schmidt, and through you, Chair Galloway. The legislation does allow the placement of ASE in school zones and in community safety zones. Those community safety zones would be defined by area municipal councils. So there is that option in future phases, should the councils see the benefits in locating those in community safety zones. I think for this initial phase, 1A and 1B, staff did recommend that we stick with school zones initially, where we think that we can get the most bang for the buck, so to speak, in terms of locating these facilities where the school children are going to be walking near and crossing around.
Okay, Councillor Lorentz.
Thank you, Mr. Chair. So I have a couple of questions as well. So when you look at Phase B, what is the next phase? I know we had a huge list of streets right across the region, but I guess what I'm hearing from the people that have called me or emailed me about this issue is they seem to be, as we move forward, there's going to be one in each municipality in the region. And when you start doing the incremental comparison, for example, between North Dumfries and Kitchener, it seems to be quite lopsided because we have the volume, we're over half the size of the region. We have the volume, we have a number of regional roads that run through with schools on them. And are we going to continue on making sure that each municipality gets one in Plan 1C or 1D or 1E. I'm just a little concerned about the rollout. I think it's I don't know if we can do it incrementally or figure out a different formula, but it seems to me that you know, it may seem fair if I lived in the townships, but it doesn't seem fair at all in the urban built-up areas.
Thomas?
Yeah, through you, Mr. Chair. The fall phase and the work we're doing right now is looking at I'll call it a more scientific or need-based way of placing the ASE. So that we plan on reporting back to council this fall with a different approach on how you could locate the ASE. So that could result in more cameras in different municipalities versus others, largely based on the need of that location for the ASE.
So instead of looking at just putting one in each municipality, you're going to switch to a needs basis. What did we use for the first one and 1A, 1B?
Through you, Mr. Chair. For the first two phases, it was really looking at it, and we spent 2 years working with local staff to come up with these locations, and in agreement with them, agreed these were the locations and agreed that to start this as a pilot, we would put, I think we started off with 4 in each of the municipalities. Then due to budget, we reduced that to 1. And then through the budget process last year, we added the additional 8. And in order to be able to add those quickly, we continued to use the same priority that we had for the original ones. But also as part of the request at budget, we were also asked to look at, is there a way to more scientifically decide where these ASE units should go? And we will be working on that through the summer and planning to report back to council on that in the fall. And that would then inform the next rollout of these as well. The other big piece of information that we need is the impact of this on our provincial offenses, because other municipalities that have already started this have found that the number of tickets very quickly overwhelms their system, because it is able to hand out, you drive past it at a speed that triggers it, and it will give you a ticket, and everyone that drives past will get a ticket. So the numbers can be quite large as people frequently don't follow the speed limit.
Well, and I agree. I tested it a few years ago when it was on the 401, and it worked quite well. But I'm wondering, as we formulate this criteria, can you send it out to us? I'd be curious to see how we're going to scientifically base what the criteria is.
Well, we're working on it in council. We will report back to council, so council will see exactly how we have done that. So it's looking, I mean, at volumes, it's looking at factors on the street. It's a number of different factors that we're going to look at, but we will report back to council on that calculation so council can see and comment.
And when is that coming, Mr. Schmidt?
In the fall. So I don't have a specific date in mind, but fall, so somewhere, say, between September and November type of time.
That seems like fall. Yeah, okay. Thank you very much.
Councillor Vrbanovic.
So I was just, I wanted to have some information in front of me when I was speaking. Thank you, Chair Galloway. I guess my question, and appreciate this updated report, and I'm certainly very pleased to see that we're going to be looking at more quantifiable data. I think all of us, as we with issues of equity, diversity, and inclusion, have learned about the differences between equity and equality. And we have taken an equality approach to this, but not an equitable approach to this by putting an equal number in every municipality, which is what I think Councillor Lorentz is getting at. And I think that's the challenge. You know, without a doubt, The safety of school children in all our municipalities is a priority for me and for all of us. But I think there's a certain reality that comes by virtue of size and population, that there's more challenges and different challenges in our urban areas and in our rural areas. But I guess where my concern really lies in terms of our pace of dealing with this. So as an example, last fall, the City of Toronto installed 50 of these devices in the city. So that was 50 cameras, 2 per ward, that they then moved around to different locations. And now they've just announced the next 50 locations that they're going to be putting cameras around, another 2 per ward. And in the 50 that they put in last year, from July through to November, so in those July, August, 5 months, they issued 53,000 tickets. We're roughly 1/6 of Toronto's population, 1/5 actually, as a region. And what it says is we really need to look at, I think, cranking this up. I mean, this is a priority for, I think, all of our councils. I know in talking with Mayor Jaworsky, his councillors have identified this. I know my councillors and my council has formally put a motion and sent it to the region previously, as council's aware of, with the concern around this. And I think part of what we need to look at is, if the problem is the court system, then we need to look at putting additional resources into the traffic court in order to manage it, and also look at our own ticket processing center. I know different municipalities in Ontario are doing that, both at a regional and at a municipal level. I think it makes sense for us to do this collaboratively as we are right now. But quite frankly, this is the single biggest issue that councillors hear about: speeding in neighborhoods. And I see Mayor McGarry also nodding her head on that. And so we really need to take a more comprehensive plan on this. Not as a moneymaker, because quite frankly, I'd be happiest if we had a whole bunch of these and they didn't issue many tickets. But to, in fact, make our community a safer community for everyone. So I'm just wondering, how do we take these next steps so that by the time we get to budget 2022, we actually can explore these things, including additional resourcing. So this may be a question for either Mr. Schmidt or Mr. Lochner.
Mr. Chair, so I can speak to our part of it. So as we start, we are planning on collecting the information on how many tickets are actually being handed out and what resources we require. I think it's not just our local capacity, it's also capacity in Toronto to be able to deal with these tickets. So there are a number of bottlenecks within the system. Without naming names, many municipalities, while they have cameras, are actually having to limit the amount of time that they're on because they are generating so many tickets that they cannot deal with the numbers that are coming out. So this is an issue not just local region of Waterloo. This is an issue throughout the province, and I will include Toronto in that, because they also have a limited ability to, so they can put out as many cameras as they want, but there is a fixed number of tickets that they are able to process right now. And they are managing their system to that. What we're trying to do is get a good handle of where we are locally. And then I think we can, through this budget process, be in a position where we can come forward and say, here's what we would need to do in order to be able to handle the number of tickets that we anticipate. And that would then be a decision of council, obviously, on how they want to proceed and move forward with that.
Yeah, and I think, Mr. Schmidt, that was exactly my point, is that other cities are looking at limiting, but part of our problem is relying on this, the City of Toronto processing center, then let's look at having our own processing center like other cities are looking at.
Mr. Lochner would like to comment.
Thank you, Mr. Chair. Mr. Regier may want to jump in as well, but I hear the points made and the interest in this. I wonder through you if we could take this away and come back with a more fulsome report and discussion then. I see there may be a ton of questions here, and I wonder if it would be better suited if we take this away as a request and come back with a report on actioning the request.
Yeah, I think that's probably a really good outcome from this discussion, not to link it to the report that would be coming back in the fall, but something separately. Mr. Regier, did you want to jump in at this time? We also have another 4 speakers.
Yeah, no, I don't have much to add here except to say that that it is complex. The issue of capacity in the court system is definitely a complex matter and relates to a variety of factors, including capacity in Toronto. I completely agree with Mr. Lochner's suggestion regarding bringing back a report looking at how we might be able to build capacity over the next little while to support this this initiative. But it's certainly if we're not careful, it's definitely possible for us to overwhelm the court system with this process. So, thank you.
Councillor Vrbanovic, are you complete?
Yeah, no, I'm comfortable with a more comprehensive report coming back as long as it sort of includes those aspects and looking at us, and having the information, then council can make the decision. But what would it take to, increase our local capacity in the court system, including, there's 2 aspects there. There's the bureaucratic aspect, and then there's the judges for those that end up going to court, and then the other piece, what would the resources be? And there's reports available in Peel and elsewhere around taking the processing in-house as opposed to farming it out to the City of Toronto.
Okay, Councillor McGarry.
Thank you. My first question would be, when will the next phase be signed for the 90-day notice of the next phase? Secondly, I really appreciate the conversation that we've just had. I with Councillor Vrbanovic and everybody else that this is a major issue. It certainly dominates our municipal phone lines and email lines when people are upset with speeding. But as we hear, it's a province-wide issue, and it's not just who's getting fined for speeding, it's how do we change driver behavior. And in that way, we can certainly have campaigns and utilize some of our road safety partnerships in order to try and target certain behaviors of our drivers in our municipalities through CAA and some of their focus on safe cycling, for instance, and certainly speeding overall. I also concur that it would be very helpful to have the evaluation and look to doing our own process in the future in order to process the tickets, because it'll be paid for by some of the fines that are obtained from those that have been in violation of our speeding rules. But I'd also say that we just had this discussion at Cambridge Council last week when we were looking at approving, and we did approve 4 pilot project areas in the city of Cambridge to reduce the default speed limit from 50 to 40 kilometers per hour in those 4 residential areas. And one of the issues and one of the complaints of some of the citizens that were weighing in on that discussion was the matter of enforcement. So it was actually mentioned in our council meeting that part of the enforcement of the decreased default speed limit will be in those particular school zones where ASE may be set up. Anyway, good, robust discussion. I'm really looking forward to some of the reports that will come back in the fall. But again, we can't lose sight of some of the other tools that we can utilize to try and target specific driver behavior in well-targeted education campaigns. Thank you.
Okay, thanks, Councillor McGarry. Councillor Foxton.
Thank you, and through the chair. And I do understand where Councillor Lorentz is coming from and Councillor Vrbanovic. And understanding equity and equal and everything else, I also want to point out that North Dumfries was probably the highest rate for speeders. You have to remember, North Dumfries is not an isolated township. We are the main route to the 401 for a catch basin and a large amount of southwestern Ontario. Thousands and thousands upon thousands of vehicles are rushing through our township. Our death rate in accidents is rising. So I don't need all my schools done, but I do need the main ones done that are filter roads coming onto the main arterial roads, leading towards these accident centers. And so I understand that the density in Kitchener and the other cities that need it. But don't discount the townships just because you think we're small. You have to think what we're connected to. You have to remember the main access to the 401 for a lot of Woodstock area and southerly, as well as easterly, is North Dumfries. That's the way. If you want to get to the 401 and you want to get to Hamilton, you want to get to Burlington, you go through North Dumfries. You go through these small towns where these schools are. Just wanted to highlight that. I know there's the same issues in a lot of cities. The congestion in your cities keeps the speed down. The less congestion in my municipality allows for a car to go in a 50-kilometer zone, 120, where the police found one small stretch of road, where the kids walked to school with only sidewalks on one side. The average speed of a 50-kilometer road was 120 kilometers an hour. So the issue's huge, and it's not our residents. It's these ones wanting to jump onto the 401. So just keep that in mind. I totally agree with Councillor Lorentz and Councillor Vrbanovic. They have more schools and more congestions. The speeds are more intense in the townships because they can be, because we're not ever going to get the enforcement. Thank you.
Councillor Shantz.
Thank you. Just, I guess, piggybacking on Councillor Foxton, she made very good points that we've made before, and appreciate that. You know, there's a couple of things to consider, and I'm sure staff have already thought of this. But there's regional roads and municipal roads, township, city roads, and at this point, we're just looking at regional roads, and we're just looking at school zones. But perhaps, and I understand it's all tied up with what the province tells us we can do. But perhaps we also need to look at where on the other roads would be strategic. I know we all have trouble with speeding, as Councillor Foxton points out. The discrepancy, the rate of speed coming through our towns is often much higher than it is through the cities. And so hoping that will be taken into consideration. And also, you know, maybe it's looking at the kilometers of roads that are in a particular municipality. I don't know what the right formula will be. I'm sure staff will come up with that. But thanks.
Okay, thank you, Councillor Kiefer.
Thank you, Chair Galloway. I just wanted to, Councillor McGarry actually made the point that I was going to bring up, or one of the points in terms of the pilot project that you mentioned going on in Cambridge. And I would encourage our staff, maybe when they're coming back with a report, that maybe have some options in terms of alternative things that could be implemented, like the reduction of speed on certain roads. Not sure how viable it is, but it is an option. Or if there's any other options that could be, you know, tabled at the time. This whole problem of speeding, of course, is not something new, and it, in my estimation, and some others that I've been talking to, it'll never go away. So I think we need to really carefully weigh all the options here. And I do think, though, that implementing the cameras for speeding, and that will allow, if you will, the police, of course, to center their activity on other things as well as speeding, which, you know, is important that we get to the bottom of it. But you know, there's other things going on, taking away officers from other things. So that's another thing that can be brought into this. And I know that the police Chief Larkin has said that they will work with the region on this particular subject. So I'm looking forward to the reports and seeing what the staff comes up with. And yes, it's a province-wide issue, and administratively a nightmare. It could be a nightmare. These things all need to be looked at and tried to work out if possible. But the sooner the better. And so I'm looking forward to the reports. Thank you very much.
Councillor Lorentz.
Thank you, Mr. Chair. And just very briefly, a few comments. This is a great discussion. But I was elected in '88. This was one of my planks of my campaign. I represented Forest Heights and Forest Hill. So this issue has been around forever. But I would remind all of the local mayors here, your councils approved these plans of subdivision, and you approve how people live in suburbia and what main streets they. So there's lots of tools and planning as well to try to circumvent some of these roads that people speed on. So I think you have to keep that in mind. And when I was involved with Greenbrook, I mean, I fought the residents, I fought the people that are using that road. Councillor Clarke lives on it. I think I drive it every day. It still works really well. So those are the kinds of measures. Sometimes simple is a lot better to try to slow people down. Mr. Schmidt mentioned that, keeping these cameras on all the time. I think you need people guessing, is it oil Olay or not? Because once people start using those cameras, they won't know if they're on or not. You don't have to tell them that they're on from 4 to 8 or whatever. If we don't have to run them, it's like Pavlov's dog. I mean, people realize they're there and they may get a ticket. And I think that's one of the big factors that we're kind of missing here. We advertised this for 30 or 60 days, whatever we had to do. We put the cameras up, people start getting tickets. The word is out. When you go buy these things, just slow down. And I think that's a big factor. I think one of the issues that I tell people is when you drive into a parking lot, people are walking from their cars and they kind of look at you like, slow down, we're walking here, right? And you're thinking, well, I'm driving here. Then you get out of your car and you start walking and another car comes by and you look at them like, hey, I'm walking here, slow down. So people have to use a little bit more common sense in their driving habits. And I think having these things is a great tool in our toolbox. There's a number of other issues, but at this point in time, I see people speeding down Fisher Hallman, down Ottawa Street, Westmount Road, and it's just ridiculous. So we need to get a handle on this and we need to do our part. So I'm glad to see that we're moving forward on this. Thank you.
Okay, I have no more speakers, but I do want to add my voice to the suggestion that we accelerate this process somehow or another. I said so when we approved the initial pilot, the 8 that'll be starting soon, and I think the ideal of having another report to come to us as soon as that can be arranged with an accelerated, the pros, the cons, the implications of some significant acceleration of the program is something that we can give direction to staff on today. So we'll leave that with staff to come back with us with that in the near future. This was brought for information. There's no recommendation associated with the item. The next item is the update on social assistance transformation, and we do have a staff presentation in regards to that, and I'll turn to Mr. Bartholomew Saunders. Welcome, Douglas.
Thank you, Chair Galloway, and good morning, everyone. I'm here to provide an update on Ontario's vision for social assistance transformation, and I'm going to also speak about 3 additional related parallel transformations that, when combined together, actually represent the largest single change in social assistance and integrated service delivery that the province has seen since the devolution of services to the municipalities in 1999. And now and I also want to speak to the integration work that we've done here in the region of Waterloo and how it positions us well for the implementation of these transformations. And now just a little disclaimer. The presentation is high level and comes with, and may come with more questions than answers, largely because it's based on a vision statement that has not yet had the benefit of design work. And so I'm going to ask you to bear with me. I'll do my best to answer questions. Some may actually not be answerable at this stage in the game. I'm also going to thank Stevie Natalochny for advancing the slides for me since I can't do it myself. Next, Stevie. Thank you. Since 1999, social assistance, specifically Ontario Works and ODSP, support Ontarians in need. Ontario Works was designed as an employment-based program intended to provide short-term financial assistance while assisting clients to move back into the workforce and ultimately self-reliance. In its earliest incarnations, there was some reasonable success. Some clients only recently separated from work were able to return to the workforce. Jobs were more plentiful. There were incentives for employers to work with employment services and make those job matches happen. What's changed since then? There's been the advent of technology, higher skilled and education requirements for jobs, advanced manufacturing, increased client barriers, physical and mental health and addictions challenges, homelessness, all have resulted in a percentage of the caseload being much harder to serve and more difficult to place in employment without broader support interventions. This has left the OW and ODSP leaving OW or ODSP to an entry-level position can be a very difficult decision for clients. Healthcare benefits that are provided by OW and ODSP are often not available in entry-level or lower-paying jobs, making the choice to stay on social assistance more attractive and, in essence, a perpetuation of poverty. OW and ODSP service system has become administratively burdensome for staff, leaving case managers little time to engage in meaningful casework, leading to life stabilization or the removal of barriers connecting clients to additional supports, which has resulted in poor employment outcomes, as was noted by the provincial auditor. Caseloads have continued to increase across the province, costs have continued to escalate, and the need for system change has never been greater, hence the vision document. Next. The province, through the Ministry of Children, Community and Social Services, has introduced the new Vision for Transformation of Social Assistance. And I want to just read the vision itself, which is quoted as point number 1 on this slide. It's to create an efficient, effective, and streamlined social services system that focuses on people, providing them with a range of services and supports to respond to their unique needs and address barriers to success so that they can move toward employment and independence. The vision recognizes that the road to independence and self-reliance is contingent upon intentional intervention to address the myriad barriers faced by clients in the current environment to stabilize their lives, support them toward attachment to the workforce, and ultimately self-reliance and independence. It still recognizes that for some small percentage of people, they may be unable to make this transition and that their needs must also continue to be met. The vision identifies the need to remove the administrative burden and non-client focused activities from caseworkers to free them up to work directly and intentionally with clients and other agencies that can address the barriers identified to assist clients to achieve a better quality of life. Next. On this slide, you'll see the core principles, and I won't review each of them because they're on the slide and you can read them, but I do want to point out the one that I've emphasized in bold. It's the principle of co-design with Consolidated Municipal Service Managers and District Social Service Administration Boards as delivery partners. This is a new direction for the province. We've not been asked to co-design with them previously, and this gives us the opportunity to bring our considerable expertise in local issues, client casework, and the need for integration across all delivery systems, and the need to work with the social determinants of health to make life stabilization effective to improve the quality of life for our clients. The co-design work is conducted by the Provincial Municipal Social Assistance and Employment Committee, or PMSIC, and its 4 subcommittees. The Consolidated Municipal Service Managers and District Social Service Administration Board are representation is at this table, as is the Ministry of Children, Community and Social Services, and periodically others attend as well. PMSIC has existed for over a decade, and it's one of the 3 provincial committees that I, as a commissioner in the province, sit on and co-chair one of the subcommittees, the Change Management and Communications Subcommittee. Next. In this new vision, we will focus on case management or possibly system navigation to connect clients to the services best suited to address their identified needs and barriers. Working in consultation, we can walk with the client along the pathway to self-sustainability. On this slide, the items that are in bold are places where we are already integrated. We've moved ahead, notwithstanding the fact that the province is just now announcing this exercise. The italicized items are where we have begun to make inroads, but where more work is required. And we have a number of projects in this region that are happening, not the least of which are Wellbeing Waterloo region and the Community Safety and Wellbeing Plan that will move us in the direction of more work in the italicized areas. And we have yet to jump into the pieces that are not bolded or italicized. These inroads that we've made are even before the vision has come to fruition or to design, and I'll speak a little bit more about that in a moment. I'll talk about how we're slightly ahead of where the province is. Next. Employment outcomes have always been required by the province, and this is where both the province and municipalities have been heavily criticized by the provincial auditor, particularly in a report 3 years ago. The first 3 outcomes have always been OW program outcomes for CMSs and DSABs, and we've always been accountable to the province for these. The provincial auditor noted 2 or 3 years ago that the system had failed to produce the required outcomes. In fact, noted that provincially caseloads were rising and called for the province to make change. This new vision sets out a co-design challenge to not only increase outcomes, but address a broader range of barriers and client issues that may require addressing the social determinants of health and partnering with additional and non-traditional partners to improve the quality of life of clients by producing life stabilization or barrier removal so that attachment to the employment sector is easier. Next. So I mentioned at the beginning that there are a couple of parallel transformations happening in addition to the vision for social assistance. Employment services transformation is one of them. Among the partners required in the life stabilization model will be employment services. At present, those services remain untouched within Waterloo region. our services and funding will remain stable through the end of March 2022. However, the Ministry of Labour, Training and Skills Development is prototyping a new service delivery model in three provincial regions where employment services have been transferred from municipal service delivery to new service managers, two of which are large-scale private operators, one of which is a Canadian subsidiary of an Australian firm, and the third is operated by Fleming College. We do know that these prototypes will be expanded to the remainder of the province at a time yet to be determined. These three prototypes have only just finished the first 18 months of their operation and are assessing with the province how to move next into the rest of the remainder of the province. Employment services transformation is overseen by the Ministry of Labour, Training and Skills Development and receives input from the Provincial, Municipal, Social Assistance and Employment Committee. Next. Part of the OW vision, part of the social assistance vision is a centralization of intake. And I'm calling this a parallel transformation because it's underway already. The vision paper speaks to removing administrative burdens to allow caseworkers to provide intentional client-focused casework to identify and remove barriers to independence and self-sustainability. 7 communities across the province are currently prototyping OW and ODSP intake, centralized at the provincial level to free up caseworkers' time for vital client-focused work. These prototypes will provide an understanding of how centralized intake can or will work and begin to define what the intentional work of the caseworker might be. At present, that's being called, the word just left me, life stabilization. So much more focus on the client and less focus on eligibility and the kinds of technology-focused work that our staff are currently doing. Next. The third parallel transformation is human services integration. The Provincial Municipal Human Services Collaborative is chaired by the Deputy Minister of the Ministry of Children, Community and Social Services. It's newly formed and is comprised of the leads commissioners, essentially, from all 47 CMSMs and DSABs, and an ADM or deputy level representative from all participating ministries, some of which are health, education, labor training and skills development, Solicitor General, municipal affairs, and housing. This body is expected to remove barriers to integration that are sometimes encountered at the local level. Life stabilization activities are likely to be made easier by the work of this collaborative. As you can see with the multiple ministries that are at the table, the intention is to clear difficulties that exist between ministerial programs or government programs that currently at times contradict one another, so that the requirements of employment programs don't conflict with the requirements of social assistance, and that those don't conflict with requirements in housing, etc. Next. This is a diagram that is, this is actually attached to your report. It's the ministry's diagram to try and show what exactly is going to happen. I'm finding it hard to read on my own screen here, and I expect you are too. But to give you a sense of where it's going, I'll just concentrate on the timeline of how we will evolve over time. So in the current state, what's showing is that the 2 social assistance programs run in parallel and separate from one another. that the ODSP is operated through local offices that are provincially run. OW is run by municipal offices that are municipally run. In the phase 1 model, the idea is that the intake will be centralized at the provincial level. So that would take in eligibility determination, and ongoing eligibility determination, and program integrity. The ODSP clients would continue to be served by the local ODSP offices, and Ontario Works clients would continue to be served by the municipalities. In the second phase, the centralized intake would continue, but that municipalities would deliver life stabilization activities for both Ontario Works and ODSP clients. And in the final stage of the model, which includes human services integration, again, the centralization of intake and delivery remains, but the municipality would integrate life stabilization activities across social assistance for people in crisis and for all municipal programs. In other words, people who are looking for or who need case management services would not be required to be clients of ODSP or OW. Eligibility for social assistance would no longer be a requirement to receive case management services from the municipality. In fact, it may be that low-income folks who without one intervention might end up on social assistance would be saved from going on social assistance by having intervention from case managers. The second half of the template is the timing. I'll concentrate only on the upper line, the timing of all of this transformative work, which is very, very hard to read. Sorry, Stevie, go to the next slide, please. So what you'll see there is, if I can, right. On the far left side is the public release of the vision paper, which was done late last month. The roadmap to co-design will be at a high level release with milestones and sequencing in the spring of 2021. In the summer, we'll have a detailed design of priority elements and a detailed plan for co-design. In the fall of 2021, we'll have a detailed transition plan. We will have a renewed operating model detailing with detailed co-design complete in the spring of 2022 and ongoing implementation thereafter. So as you can see, the province is moving very quickly on this exercise, and it's intended to be done within the space of a 3-year period. Next slide. So what does this mean for the region of Waterloo? If we go back to prior to our integration work locally, clients would come to the municipality, to one of our offices, seeking services, whether they're social assistance or employment and income support, children's services, or housing. The client would have to go through multiple intakes. They would have to go to multiple service desks or even buildings to get these services. They would have to tell their story multiple times, and the services could not, the individual services could not talk to one another because the confidentiality prohibitions in each of the pieces of legislation precluded case discussions from one program to the next. Next slide. In our current model, the client, at the point of entry, there's a service navigator who assists with the application process and ensuring the client not only gets the service that he or she comes in seeking, but also assesses for the need for other services. They tell their story once, an application is taken, they are assessed through ROWAN, which is the Region of Waterloo Opportunities Network. And I'm going to come back to that in a moment. There is a shared consent signed, totally up to the client whether they sign it or not. The shared consent allows the staff, the integrated team, to talk from service to service to be able to provide a coordinated approach to services rather than a siloed approach to service. And then they move on to case, I'm sorry, that says OW case management. It should say case management. And then potentially move on to employment from there. So what we have is a much more coordinated, integrated opportunity for case management. Within the case management system, the case managers will also make referrals for mental health issues, employment issues, and a variety of other issues like literacy, tax filing, a variety of other things that the client needs and identifies in the case in the course of the case management exercise. I want to go back to ROWAN for a moment. We are not the only municipality at this point that has moved further into integration than the province has yet. We're actually quite ahead of the province, and they have consulted us on what we're doing. And if you look at what they're planning in their schematic, it follows very much what we've already done here in the region of Waterloo. The other municipalities that have moved in this direction also have a technology similar to ROWAN. It's called, in other jurisdictions, it's variously called Ben or Clarke. And don't ask me why they're all called different things. I have no idea. But the difference between ours and what the other municipalities are doing is that ROWAN builds in an assessment of quality of life. So if you think back to what about quality of life and life stabilization activities, we have already built into our technology the ability for staff to assess those things and to be able to determine what supports and services are necessary and need to be referred to in order to move the client along to self-sustainability and self-reliance. So we're actually well on our way to being able to implement what the province wants. We're also in an exceptional position to be able to influence where the province is going. So Stevie, you're going to have to push several buttons to go past this one to get to the next slide. Keep going. Thank you. Back up one. So we have the vision, we have life stabilization, and we're going to have we're going to have life stabilization and case management. And what does the future look like? Well, we had intended to provide a picture of what the future service system would look like. As we tried to do that, I realized that there were too many unknowns and that we were relying on speculation. Speculation is always a problem that could well lead to inaccuracies and lead to false expectations. So we decided that we wouldn't continue with that exercise, because what we could come up with and show you, the next slide, Stevie, sorry. The one with the question mark, thank you. What we decided was not to draw something that would be perhaps inaccurate or way off the mark of where we end up with the province, because the design work hasn't started. But what we can say is that the burden of administration, eligibility determination, program integrity, and data entry for social assistance programs appear to be being centralized at the provincial level. removing the non-client need focused functions from our caseworkers. They will now be freed up to do what they have told us they came into this business to do, and that's to work directly with clients to eliminate barriers. I can say that access to case management services will no longer be dependent upon eligibility for Ontario Works or the Ontario Disability Support Program. We say that the vision contemplates a case management function that intentionally focuses on life stabilization for all clients, where the focus is the identification and removal of barriers that restrict quality of life. We can say that the vision contemplates the caseload consisting of current OW and ODSP clients and potentially other low-income individuals who, without some intervention, might well become social assistance recipients themselves. In other words, we will be doing some upstream work. Finally, we can say that because of the integration and restructuring work that we have undertaken in the Community Services Department over the last few years, that parallel us or put us slightly ahead of the province, we are well positioned for success as these transformations come to fruition. We cannot identify yet whether there will be cost savings from this exercise. We can identify that the expectation is that there will be no additional costs to the municipality. That has been stated clearly by the province, as well as those of us who are representing the municipalities, that this change cannot represent additional costs to the municipality. And my last points have disappeared from my screen. So I'm going to leave it at that and open it up for questions.
Okay, thanks, Douglas. The first, we have a few questions or comments. Councillor McGarry.
Thank you, and through you, Mr. Chair. I think this is one of the best overviews of the system I've ever seen, so my compliments to yourself and to your team. I think that many people don't understand the complexity of dealing with individuals that do have barriers to employment and do have life barriers that can't just suddenly buck up and get a job, which is common of what you hear in the community with individuals that have challenges. And very often they're challenges that are not of their own making. I can see that you have, and your team in this region has a handle on very complex situations. And, you know, from somebody that did spend very many years in case management in home care in this region, I probably feel uniquely qualified to ask some of the questions and also offer some of the comments, because a great deal of clients on my caseload over years at CCAC and then the LIN in this region dealt with people on OW and ODSP. So I just had a couple of comments and would certainly offer any assistance in even just being a sounding board as you move through this process. And I'm incredibly proud of the work that the region of Waterloo has done in the province. And obviously we're always leaders in these kinds of things. So I will offer some assistance that way. But one of the pitfalls that I see going ahead with this, and you've probably identified them already, is there's ongoing support that's needed for any client that's on OW or ODSP in the future in a great many positions. One of the main barriers I used to see in people not coming off social assistance when they had the opportunity to work was the cost of their medications. Of our recipients are on medications, and once they had their Ontario Disability.
Catherine, you're freezing. Maybe you want to turn your camera off.
So I think that Councillor McGarry was about to say that one of the difficulties is the costs of medications when clients go off OW and ODSP. And that was one of the things that I was alluding to when I talked about perpetuating poverty in this population, is that many jobs that clients are qualified to go to or are able to land are jobs that don't include benefits. At present, we're able to provide them with extended health coverage for, I believe it's up to 6 months beyond the end of their time with Ontario Works or ODSP. It hasn't been addressed as yet. This is the vision work is fledgling work. It is one of the things that I would be raising at the table to talk about how we deal with that, given that many of the types of jobs that typically our clients would have gone on to no longer exist. If you think about what technology has done to the labor market, there are jobs that that many of us do ourselves now. For instance, we do internet banking. We don't go to a teller anymore. We pump our own gas. We don't have someone do that for us. When we go to the movies, we don't buy a ticket from someone in a wicket. We actually purchase it through a kiosk. Advanced manufacturing has also taken away some of those entry-level jobs that our clients would have gone to in manufacturing through robotics. If you look at Toyota, many of the jobs that are done at Toyota on the line are done through robotics, where people operate those robots. So we need to reimagine the entire employment exercise and the skills required to get to employment, which would be one of the things that our staff needs. They actually have health coverage from their new employer. So thank you for that comment. And I certainly will be raising it with the provincial team.
Okay, Councillor McGarry,
Sorry,
you're back.
Catherine, I just jumped in and answered the question because I thought I knew where you were going.
Councillor
Thank you.
McGarry,
And
you're
if I could continue, sorry, one of my systems here sort of failed in the middle of that. I did want to just also identify that there are some individuals that need some of that life stabilization ongoing in terms of banking and rent payment and handling money. There are some that just cannot get a handle on managing their their affairs to the point where it can certainly destabilize as well as their ability to have ongoing housing. And I think that without help with some of the life stabilization activities, good intentions are not going to assist that person in a long-term relationship with an employer. So I know you have an eye on it. And as I said, I think these are really important for the provincial government officials to understand too, that certainly once somebody gets employed doesn't mean that the support should fall away, because that employment can end up failing. And in the end, we're not any further ahead as a municipality. So really appreciate it. And as I said, I'll certainly answer any call to put in information on this in the future. Thanks very much.
Okay, thanks, Councillor McGarry. Councillor Clarke.
Thanks, Chair Galloway. Douglas, I'm trying to find some reassurance in what I think is a tone of positivity or even optimism in your presentation. I have some concerns, and maybe I'm looking for more reassurance. I was certainly one of the ones over the last couple of decades. Am I getting a? I'm hearing a lot of echo. Is it just me? No, I'm good. Okay. It was probably Bruce. I've been calling for social assistance transformation for a couple of decades now, and what I'm not seeing here is any transformation in the area that I think is the most important to transform, being the amount of income that people on OW actually receive. I'm having, I think the reference to employment-focused case management, while necessary. I think we all accept that. It's giving me flashbacks to 1999, and I think that was a process that was extremely punitive and extremely harmful, and I'm worried about that. When I see the report in the purpose or the preamble to the report, and I don't have it open at the moment, there is reference made to the provincial financial situation and the constraints, and that being at least a partial driver of this transformation. And that makes me nervous too. Where are these savings coming from for the province? Is it purely from efficiencies and removal of red tape, or is it going to come in any part from cuts to the people who are already really, really struggling to live on an amount of money that nobody can even pretend is adequate? So I guess I want to hear from you. Do you have any insights about the actual amounts of OW? Is that something that's being discussed, or are we too early in that? And do you think through the ability we have to work on the co-design, do you think we'll have opportunity to do things that may ameliorate the harms to people that the persistent low OW rates continue to create?
Thanks for that question, Councillor Clarke, and through you, Chair Galloway. The interesting thing about the vision is that it is completely silent on rates. So being a glass half full kind of guy, I take that to mean that it's on the table for discussion. The province may take it to mean that it's not on the table for discussion, but until until it gets put on the table, we don't actually know whether it's up for discussion yet or not. There isn't a subcommittee specifically addressing rates, but I think that the way this has come together, and with the province's openness to hear from not only the municipalities on co-design, but to do some fairly extensive consultation with end users, or the folks who are on ODSP and OW, that we're going to hear a significant amount of information about rates. Certainly, I will raise it because it's something that, like you, I've been concerned about this for over 10 years. I've been concerned about it since the 21% clawback on rates 24 years ago now, and that we're really, the system is designed to hold people in poverty. There is no way to get out of it. If you're living solely on Ontario Works or even on ODSP, and you are unskilled and unable to acquire the skills of the modern day labor market, without those, you can't be successful in acquiring the income necessary to be able to provide for yourself and or your family, and pay for what are sometimes exorbitant costs of medication, as Councillor McGarry mentioned, and other kinds of things that you need to be able to manage your life. So I'm hopeful, and again, I want to reemphasize that we're at a fledgling point in this, that we will bring that up at the table. I'm confident that my CMSM and DSAB colleagues will equally be interested in that, and that there will be a fairly fulsome discussion on it. Of course, the province owns the program. Now we pay cost of administration at 50%, but the program costs are totally borne by the province. So they hold the purse strings on that particular issue. But I think we can certainly raise the issue and explain what we see at the frontline level. We're the ones who get to see it. I'm mindful of the, when the rate clawback happened years ago, I was the direct services manager, or the program manager, sorry, for family benefits for the province in the Toronto regional office. And I will never forget the day. This was the reason I left the province. I'll never forget the day that a manager and supervisor walked into my office, both in tears, because 3 small children had been left in the waiting room by their parents. And the parents told the workers, "You look after them, we can't afford them." And they walked out and left those 3 small children, all under the age of 5, in our waiting room. And that was what actually caused me to leave provincial service and move on to municipal work. It's something that has haunted me ever since then, and it's something that I believe thoroughly needs to change. It's one of the reasons why I have always said to staff that if one directive says you can't grant the benefit, look further in the directives to see if there's anything that will allow you to grant it, and then err on the side of safety and err on the side of the client. So we will bring it up, Councillor Clarke, and we will make sure that it's on the table.
Councillor Shantz.
Thank you. A very comprehensive presentation, Douglas. Thank you. You know, I think the fact that we're sort of ahead of the province is a testament to the good work that you and your department have done over the last years, having a centralized intake. And I mean, anyone who's tried to navigate any of the social systems or the healthcare system knows that it's not easy. And so I think it's really important. And I like this direction where we can surround people. One of my things has always been support of the working poor, and I think that's part of what this is trying to address. And if I'm wrong, correct me. But you know, how can we talk about wraparound services for addictions and that kind of thing? But you know, I think we need wraparound services for the working poor and for people who are having trouble just navigating the system. And so again, I think we've tried to do that. And maybe you can just speak to that. With our intake, has it always just been OW and ODSP, or do we support the working poor in that system now in the region? You're muted.
Yeah, sorry, I didn't realize that. Thank you for the question, Councillor Shantz. So the social assistance system is really an interesting system. It's designed, as Councillor Clarke said, the way the system and directives are written, they're written from the standpoint of stewardship of taxpayer dollars. So there's a fair bit of rigidity in the system, or appears to be a fair bit of rigidity in the system, of who you can provide services to. So if you're eligible for OW, then you get service. If you're eligible for ODSP, then you get service. If you are a low-income working family and you don't qualify specifically financially for OW, typically you are not eligible for service. Now, that said, if a low-income family comes forward, the caseworker has the ability to look at the issue that brought you forward and make a determination of what's the best thing to do. Do I provide for this issue and avoid this person coming back a month from now as an applicant to OW, or do I not provide for this issue and ensure they're coming back as a client a month from now? So what can happen is there is the ability to grant 2 weeks emergency assistance. which allows us to treat the person as a client for a short term to be able to get them over the hump of whatever the issue is, and then they are no longer a client after that. They go back to managing on their own. So we do have that ability. I don't know to what degree, I should have thought of this before this presentation, but I can't tell you to what degree we use that. I know that when I was in Halton, we used it fairly regularly, and that was partly because of the manager who was in place. I was the director there, and the manager who was in place was really specific with her staff that we wanted to avoid people coming on OW, so we needed to assist them before they came on. That manager is now our director here in Waterloo, so I expect she's saying the same things to the staff in employment and income support now. So I expect we're using it reasonably well here. But the new system would actually contemplate the notion that because you don't have to be eligible for OW or ODSP, we still have the opportunity to provide supports to you through other agencies. So if your issue is health, or if your issue is financial literacy, we have the ability to attach you to a service to deal with either and to follow the work that's being done to ensure that you're getting the help you need. So I think it's a much broader form of it. Well, it is a much broader form of caseload or casework that's being contemplated, and a much more helpful form of casework that's being contemplated. And at the end of the day, the hope is that it will result in better services for clients and potentially a reduction in caseload overall.
Thanks, Douglas. That's helpful. I mean, we talk about upstream services, and that's key. Somehow we need someone somewhere that's going to kind of pull all the pieces or direct people to the right pieces, whether it's housing, social assistance, mental health issues, or what have you. So thank you for that.
Thanks.
Councillor Erb.
Thank you, Mr. Chair, and thanks, Douglas, for this overview. And it's good to hear from Councillor Clarke and your concurrence and nodding that there's obviously going to be conversation at the table about the rates that are now paid for Ontario Works and ODSP. It's just not acceptable that we expect people to survive on a daily basis with the rates that are currently being paid. It's not workable. I'm wondering in this conversation, is there any concern that there may be more downloading to the area municipalities from the province? Any sense of that?
So I suppose it's hard to say. When you look at the schematics and the notion that it would appear that the province is going to be asking the municipality to be providing the life stabilization work for both ODSP and OW clients, one might argue that that's downloading. However, at the same time, the province is uploading the eligibility determination work. So all of the work that our staff currently do to determine eligibility for OW clients, the province can start to do. And already is doing it in 7 municipalities across the province as a prototype to understand how it works before rolling it out across the province. I don't know on a net basis whether those equal out, but I think there's a great deal of discussion about what does that mean and what does it mean cost-wise to ensure that there is no additional cost to the municipality, which is a principle that my colleagues and I who sit at the table have been very clear about, that there cannot be additional costs levied against the municipality in any of this change. So optimistically, I'm saying there will be no further downloading or no further costs assessed to the municipality. But practically, I'm saying we're too soon to be able to answer that question. And I will say that if there's any hint of further costs being associated or being downloaded to the municipalities, we would certainly, all of us would be keeping our councils involved all the way along in this work so that we can, in a unified way, say that's not acceptable and that we're not interested in playing that game. I should say also that both AMO and OMSA, the Association of Municipalities of Ontario, and the Ontario Municipal Social Services Association are very involved in this work with us. So Chair Redman will hear about this work at the AMO table, and she may already have heard some of it, but we'll be hearing about this periodically at the AMO table, where the roundtable politicians there will have an opportunity to chime in, and each of us who represent municipalities or DSABs will be bringing information back on a periodic basis. So you can expect to be hearing from me periodically, and anything that you have to say to me about agreement or not agreement with where the province is going, I will be taking back to the working tables.
I think you're muted, Jim.
Thank you.
Okay. Councillor Foxton.
Thank you. And actually, through the chair, I'm going to pick the brains of those that attended the talk done by Laura May. When she talked about the work, the individual that went COVID, they were talking about women and the effects of COVID and their jobs and their careers and the number of jobs lost because a lot of women worked in the hospitality field or as caregivers or whatever. And the one individual that went back to school and got a better education to provide a job and then found out the job was not enough to sustain the needs. Now, ladies, can you help me out on this situation? Because they had to leave their job and go back onto assistance. Can anybody clear up that message for me? And will this help, this program help? And if not, how do we make that better for people?
Okay, who is going to take that on? I don't see any takers.
I guess everybody has the same memory as I do.
Is that something that somebody can get back to you on, Councillor Foxton, or is that just a comment?
No, it was a really good case that she brought forward. I may reach out and ask Laura May to send it to us, and then I'll forward it to you once I find it.
Okay.
Thank you.
Thank you. Councillor Jaworsky.
Thank you. Through the chair, thank you very much for this, Douglas, of this this map of how we're moving forward, a bit more resilience, building into our own system and some self-sufficiency here. I'm wondering about groups like House of Friendship. So if I go visit Sunnydale Community and the Sunnydale Community Center, the House of Friendship people there help some of the neighbors fill out the paperwork, either for cultural reasons or language barrier reasons. And I see we're working towards essentially eliminating some of the paperwork. So I'm wondering, could you tell me how those groups might be involved with the region as we look towards this modernization?
In terms of helping with applications, that's something that that hasn't been discussed at this point. All we know at this point is that the province is going to centralize the process. I would hope, and again, we've only had one meeting. We've had two meetings. I would hope that the province has the ability to use, for people who don't speak English as a first language, has the ability to use the language line and interpreters the same way we do. But it would not be, it wouldn't be impossible, and in fact would be reasonable to assume that if a client wants to make an application and they're doing it online or by telephone, that they could still get the same assistance through our community partners and even from us to assist them to sit down with at the computer and complete the online application for assistance, and or assist them on the telephone if they're making an application over the telephone. We would expect that in the process of life stabilization, that we would identify that barrier, which is either a social or a language need or whatever that need is, and that part of life stabilization is removing that barrier. So attaching that person to, say, the Multicultural Center for translation purposes or interpretation purposes, and or if it's someone who just has difficulty dealing with bureaucracy, having a caseworker assist them in completing the form or doing the work on the phone with the province. I don't think we'll see any of that change. What I think we'll see is that it will become more formalized and more fulsome. It will become a more robust system. At least that's what I hope for in this region. As we move forward as the vision allows us to move forward, in my mind, what we've built so far is a pretty reasonable integration process locally that I'd like to see become much more robust. And on the heels of what the province has put in front of us, it makes sense to me that we would be able to build this out to a wraparound system that is very robust, where nobody gets left behind and everybody has the supports that they need to be able to become self-sufficient to the level that they're able to reach.
Thank you very much, Douglas.
Thanks, Dave.
Councillor Jowett.
Thanks, Chair Galloway. So very interesting, all of it.
Helen, you're really faint.
Sorry, it's this thing here. Is that
There you
better?
go. That's better.
Oh, okay, sorry about that. So Douglas, I heard about this pilot project through the province where 90 people were put on this pilot project where they centralized the administrative services. And so that's probably been going for what I can estimate is to be about 6 months, if I'm not mistaken. And have you realized or seen any efficiencies gained through the centralized systems organized by the province thus far? Are you seeing some of that trickle down benefit?
Thanks for the question, Councillor Jowett. I'm not sure what program you're talking about, but I can say that the centralized intake is operational in 7 communities. It's only recently begun, so I don't think it's been happening for 6 months. I think it's probably somewhere in the neighborhood of 3 months. And at this point, they're still trying to work out all the bugs of it. Although Carolyn Schoenfeld, Carolyn, are you on the call?
Yes, she is.
Okay, Carolyn's our Director of Employment and Income Supports. Carolyn, have you spoken to any of the communities that are already doing centralized intake, and can you give us a sense of what they're experiencing at this point? I can't remember whether it's 3 months or 6 months that they've been doing it. Maybe you can clear that up too.
Yes, so through you, Mr. Chair, they sometimes the 7 municipalities will come to different meetings that I attend. It's been in place since November, and it's really, really early. They are still, as you've said, ironing out the bugs. some of the concerns are that, we still have people who walk into offices to apply for assistance. So what do you do when someone walks into the office? Do you refer them back to the province and have them take a call from the client and send them back to the municipality, which is what we're not looking for, right? So the people applying online, the information we're getting is that it's working well, but it's the nuances of if somebody walks in to a local office. So they don't have a lot to offer at the moment, and they're still working on it. That's really all I have to offer at this time.
Okay, it's just from what I understand of ODSP and OW, and even some of the conceptual intention of centralizing some things. So there was 90 clerks put on administrative services intentionally throughout the province to do just this work.
Actually,
you're what I'm referring to.
I do now, Councillor Jowett. It was about 6 or 7 months ago that the province advertised for those positions. That is in fact centralized intake for OW and ODSP, and those are the caseworkers and clerks that are managing the 7 municipalities that are currently within the prototype process. We don't have enough information yet about how it's working to determine whether there are efficiencies or not. What I do know is that my guess would be that when they centralize intake, there would be some kind of discussion about whether or not municipalities would continue to be funded for their full intake services. So that's where there will be a discussion, a fairly, I would expect, healthy and robust discussion about if we're going to, if the expectation is for us to do this broader, intentional life stabilization work, taking staff away would be counterproductive to being able to do that work, that they would need to leave us funded in a way that we can actually take on that more enhanced casework. But those are all discussions that haven't happened. They're things that we'll have to turn our mind to as we move forward. Similar discussions will have to take place around the employment services transformation. In the area, employment services are being prototyped in a different way. I know that municipalities have had to give up a considerable portion of their budget to the province so that the province could then fund the new service managers who are doing employment services work now. So that is yet to be worked out with the rest of us who are not yet in that model. So we'll see what that looks like as the prototypes roll out. But we will be fully engaged in the discussion about it.
Thanks very much, Douglas. I appreciate it.
Okay.
Okay, I have no further speakers. Thanks for the very robust discussion on what is a very important topic, and I'm sure we'll have ongoing updates on this as this whole process rolls out, as was illustrated to us today by Mr. Bartholomew Saunders. The next item is the Community Safety and Wellbeing Plan, and I'll ask Mr. Lochner for some comments in regards to that. Mr. Lochner?
Actually, Chair, if I could turn it over to Ms. McDonald, please.
Okay, Connie?
Thank you and good morning. As Council's aware from previous reports, the region of Waterloo is responsible for leading the process and developing a community safety and well-being plan. This is a process that was started in 2019 and in early 2020, and is a requirement as part of the legislation under the Police Services Act. As this process was just getting underway in 2020 and engagement was starting, we then found ourselves in a pandemic, and this work was put on hold. And the Ministry of Safety and Correctional Services has now extended and given us a new due date of July 1st, at which time the region of Waterloo was required to submit a community safety and wellbeing plan to the province. The purpose of this plan, if I can go back to some reminders of the original process, the intent of this is to encourage a collaborative and multi-sector approach to planning for community safety and well-being across the province. And I think something that Waterloo Region prides itself on is that this is kind of how we do business. We're as a community that collaborates. We're known as a community that is forward-thinking. And we're fortunate to have a number of great collaboratives in Waterloo Region looking at this work already. So the community, the Wellbeing Waterloo Region, the Crime Prevention Council, the Children and Youth Planning Table, the Local Immigration Partnership. We have a number of current bodies that are looking at how to improve health and wellness in our community to date. And so when looking at some of the plans that other municipalities are starting to develop, many are actually at the very beginning stages of thinking about how their community might come together from a multi-sector approach to address these challenges. And I'm proud to live and work in Waterloo Region, where we've identified this need many years ago and have made some great strides in how we do this as a community to date. I think, though, as we look at what's happened over the past year since the planning for this process started, I think a lot has changed in 2020. And we've talked as a community about the social determinants of health and well-being, but we've actually seen play out very significantly and very seriously the impacts of the social determinants of health through the pandemic. And I think we have a great opportunity as a community to pause and look at all of the work that we've done so far, to look at what people have experienced through the pandemic and come together in terms of a path forward for community safety and well-being in our community. When you look at the plan requirements for a community safety and well-being plan, they're very prescribed by the ministry. And so things such as an advisory committee, things such as, the basic stakeholders that are required to be engaged. And given the work that the region has done to date, we could more easily write up a document that outlines all of the work that's been done to date, lean into all of the work and conversations and engagement that have happened, and produce a fairly simple plan for July 1st and hand it in. My concern with that approach is I think our community has come to expect something different from Waterloo Region, and that's to be looking forward, to be leaning into the future, to look critically at where we are and to take into account all of the feedback that the community has come to us with over the past year, and some of the work that Council has directed staff to do as part of the strategic plan. So really looking at this as an opportunity to critically evaluate sort of where we are, and to look at what the path forward might be in the future. And so there are a number of recommendations on the table for you today. One is the creation of a steering committee to oversee this important work. That would include an advisory committee that would meet the provincial obligations in terms of the stakeholders that must be engaged. These are outlined in legislation in the Police Services Act, and that includes, a representative from the LIN, someone from the education sector, someone from, youth justice and others. And then there are also a number of recommendations around how we go about producing this plan, and a recommendation to bring in a third party with a fresh set of eyes to look at the requirements, to provide some support to staff and leadership in this. And asking them to do a number of things. The first being a review of the planning on community safety and well-being that we've done to date in this community. The second, to lead an engagement process. So not discounting all of the engagement that we've done to date, but identifying where there are gaps and where we might need to do further engagement. And particularly with Black, racialized, and Indigenous communities, and identifying their needs in a community safety and well-being plan. The third would be to produce the plan. I don't think it's a secret that the region is quite busy right now in terms of a number of different priorities: pandemic response, vaccine rollout. And so this would be critical help for us in organizing, coordinating, writing, producing in order to meet that provincial deadline of July 1st. Third, to make recommendations on implementation and committees and bodies that are involved in implementing the plan. And also recommendations on upstream funding to achieve the plan. I think the more that we talk about well-being and the social determinants of health, the more that we're talking about the need for upstream prevention. And, I think that Council's investment in affordable housing this year is probably one of the largest upstream investments that the region has made, knowing the impact of access to affordable housing on one's health and well-being. And so, some of those types of recommendations as we identify and confirm community priorities for where those upstream investments would be most valued. And that leads to the last recommendation, which is Chair Galloway's motion as part of the 2021 budget process allocated $250,000 for community engagement on an upstream investment strategy. And seeing the tie-in between upstream investments and community safety and well-being planning, we're recommending if we could use some of that funding to start this conversation, the start of the plan, and then would come back as part of implementation to continue that conversation with Council on upstream funding. And that is what I have here today, and I'm happy to pass it back to you for any questions.
Okay, thank you very much, Connie. Is there any questions to Connie in regards to this? So this is, I think everybody understands, and we've heard about this for some time, a requirement under the Police Services Act. And as Connie has indicated, we're really well positioned in this community to undertake this work. But just to be clear, the initiative that we approved in the budget process, that upstream initiative that we discussed and approved, is a much bigger and broader initiative than this. This is necessary. It really does start the conversation, but it is a regulatory and highly prescriptive piece of legislation that we have to comply with under a fairly tight timeline, and the use of a third party is probably required in order to get this work done. So I've got Chair Redman and Councillor Jaworsky. Chair Redman?
Thank you, Chair Galloway. I just really wanted to speak in support of this for a couple of reasons. One of them is we're not duplicating service, but we're looking at gaps. I think this whole strategy makes incredibly good use of previous work, groups that are already engaged, and the funds that we're going to put forward. All things continue to change in this pandemic, but I've been in meetings at the provincial level where the Solicitor General was asked if there will be another extension, and she said, no, you've had lots of time. So rather than do something sort of superficial and quick and dirty, I really support this because I think in the long term, this is the direction Council has already given and where we hope the community will go.
Thanks, Chair Redman. Councillor Jaworsky.
Thank you. Through the chair to Connie, but I'll ask Mr. Lochner to listen in as well. Sketch this out a bit further. If I look at this, if it's under the Police Services Board or this directive is from there, we're going to come up with a plan for July 1st. However, what we heard in the most recent presentation from Douglas was a lot of other things that really help out our community as well. And so eventually these things somewhat, I wouldn't say dovetail, but move along in parallel. So I'm just wondering, July 1st, we submit the plan, then what? I'm looking for that. If you could answer that, Connie, that'd be great.
Sure, and thank you. Through you, Mr. Chair. I think some of that is still to be determined, and I think part of that is the value of bringing in the third party to look at how we're doing things. I think, none of us have a crystal ball, but we're all pretty informed on what the needs and priorities are in our community. And I think that, some of the work underway needs to continue. And I think that this will help us to identify in some ways in our community, we have really great conversations about needs and gaps, but we need a little bit more push on outcomes and measures and how we're actually moving the needle for people as we're addressing community safety and well-being. And my hope would be that through this process that we could get a lot more clear on the implementation front of who needs to take which pieces and by when, so that we're really supporting residents.
Thank you. Yeah, I looked at one of the booklets there, a snapshot of local voices, and it looks like there's a lot of areas to be covered. So, pleased to see what comes out of the plan. So fair enough. Thank you, Connie.
Thanks, Dave. Councillor Shantz.
Thank you. And thank you for the report. I would just offer to sit on that committee if it's appropriate.
Sure, that's it does require a member of council, so that's if you're volunteering, that's fine. Chair Redman.
Thank you. Just further to Mayor Shantz or Councillor Shantz's offer, we would take the representation from Waterloo Regional Police Services Board back to the board to bring forward names.
Okay. All right, then. There's a recommendation associated with this report. It's moved by Councillor Jaworsky, seconded by Councillor Jowett. If you would now vote with your yes and no icons, please. And that's carried. We've got two more items. I think we can probably finish quickly, then we can have a break before we go into closed session. The next item is the optional small business property subclass. The recommendation there is to take no action, as explained in the report. Are there any questions in regards to this report? Seeing none, it's moved by Councillor Clarke, seconded by Councillor Erb to take no action at this time. So if you would vote accordingly. And that's carried. The next item is the SAFE. This is the additional item on the addendum agenda. The SAFE Restart Agreement Funding Transit Stream that Mr. Dyer has authored or approved. Is there any questions in regards to this particular matter? Okay, if not, then it's moved by Councillor Harris, seconded by Councillor Jaworsky. If you would now vote. Okay, and that's carried. Are there any other business to bring to the meeting? Okay, seeing none, we'll have a motion by Councillor Harris, seconded by Councillor Kiefer to go into closed session. You would vote at this time. Okay, and that's carried. Our next meeting is April the 13th, and I'll now entertain a motion from Councillor Lorentz and from Councillor McGarry to adjourn. You would vote. And that's carried. So we will start closed session in 10 minutes at 20 to 12. See you then.